Hi friends, welcome to EZI Nurse where nursing education made easy. Today we are going to discuss some important exam oriented questions from medical surgical nursing. So be alert everyone, these questions will definitely come for the next exam. So don't skip it, watch till end. So let's see what are the important questions that may appear for the medical surgical paper. So the first question we are going to discuss is hypertension. This question will definitely come for a 10 mark or a 5 mark. So what is hypertension? Let's discuss. So hypertension is defined by American Society of Hypertension and the International Society of Hypertension as systolic blood pressure of 140 mmol of Hg or higher. So systolic pressure, how it is? It should be 140 mm of Hg and it should be more than 140 mm of Hg and a diastolic pressure of 90 mm of Hg or higher. So the diastolic pressure will be 90 or more. So and the based on the average 2 or more accurate blood pressure measurement taken to 1 to 4 weeks apart by the healthcare provider. So, first time when you are checking your BP is more than 140/90, that does not indicate that you have hypertension. When that person is checking continuously, 1 to 4 week gaps, he is checking and the blood pressure is more than 140/90, then it is considered as hypertension. So, this is the definition of hypertension. So, definition of hypertension also will ask for a 2 marks. So, don't forget what is the definition of hypertension. Now, we will see the types of hypertension. So, it is divided into 2 categories, primary hypertension as well as secondary hypertension. Primary as well as secondary hypertension. So, let's see what is primary hypertension. So, it's also known as essential hypertension. It's an end result of an interaction between environmental and genetic factors. So, it is mainly due to environmental and genetic factors, and primary hypertension has no clear cause. It develops gradually over time influenced by factors like smoking, diet and obesity. So, it's mainly due to that person's obesity as well as smoking and this diet. So, the unbalanced diets. So, this is the main causes of primary hypertension. Now, let's discuss about secondary hypertension. So, what is secondary hypertension? It's a type of hypertension where an identifiable cause exists which can be endocrine tumor, kidney disease or side effects of many drugs. So, here we can identify the exact cause. Why it is? It is secondary to some diseases or secondary to the effect of some drugs. So, that is defined as secondary hypertension, and it affects only 5 to 10% of people but can be severe and resistant to treatments. It's only affecting 5 to 10% of people but it is very severe condition. So, this is the definition and types of hypertension. So, what are the types? Primary and secondary. Now, we are moving to another category, nursing management. So, nursing management is very important. So, while writing a disease condition, you need to write about the nursing management. So, what is the nursing management? Monitor blood pressure regularly and assess the signs and symptoms of hypertension. So, monitoring the blood pressure, checking the blood pressure regularly. Teach the client and family about weight control, stress reduction and smoking cessation. So, weight control is important, stopping of the smoking is important, and as well as stress reduction. Discuss the importance of low sodium diet. So, the diet they are having, it should be low sodium. So, sodium will restrict the hypertension. So, if you are reducing the amount of sodium, that also we can control the hypertension, and administer antihypertensive drugs as prescribed. So, what are the main drugs here? Beta blockers, antidiuretics. So, these kind of drugs we need to administer. So, administer medication. Emphasize the importance of adherence to medical regimen. So, tell that patient it's very important to follow up and it's very important to take medicines daily. So, high blood pressure is a silent healer. So, what we need to do, that person need to take the medicine. So, this is the nursing management. So, nursing management is very important in the case of hypertension. Now, we will see another category. This is a 2 mark question. Usually, it will come for 2 mark. Hypertensive urgency. So, what is hypertensive urgency? It occurs when blood pressure spikes. The blood pressure reading should be 180 or by 110 or higher, but there is no damage to the body's organ. Here, the suddenly blood pressure will increase. So, the blood pressure will go up to 180 by 110. So, what is happening here? There is no organ damage. Oral doses of fast-acting agents such as beta-adrenergic blockers, labetalol, and EZI inhibitors captopril. So, the main treatment for this is EZI inhibitors as well as adrenergic blockers. So, these are the hypertensive urgency. So now we are going to discuss about another 2-mark question that is coming from hypertension, that is hypertensive emergency. This is also a 2-mark question. So what is hypertensive emergency? Let's discuss. So it means blood pressure is so high that organ damage can occur. So this blood pressure is so high, there is organ damage also. Multiple organ damage will be present, that is hypertensive emergency. Symptoms include headache, blurred vision, confusion, seizure, chest pain, shortness of breath, edema, and intravenous vasodilators such as sodium nitroprusside, nicardipine, and clofepidine. These are the medicines we are used for hypertensive emergency. So this is hypertensive emergency. It means blood pressure is higher and it is also causing organ damage. In hypertensive urgency, what is there? Blood pressure will be more than 180 by 110, but there is no visible organ damage. So now we are moving to another important question, burns. So burns is very important because it is 10-mark or a 5-mark question. What is burns? Let's discuss. Burn is an injury to the skin or other organic tissue primarily caused by heat or due to radiation, radioactivity, electricity, friction, or contact with chemicals. So burn is nothing but the damage of tissues or skin that due to any heat, overproduction of heat, exposure to heat, as well as electricity, friction, contact with chemicals. So this is the definition of burns. So burns definition also is very important. Now we will see types of burns. It is mainly classified into, it is divided into different types, that is thermal burns, radiation, chemical, electrical, smoke, and inhalation injuries. So these are the main types of burns. Now we will see another important classification. So burns is classified into 3 main categories. So what are the main categories of burns classification? Superficial partial thickness, deep partial thickness burns, and full thickness burns. In superficial partial thickness, or the layers of the skin, upper layers of the skin will be burnt, and inside deep partial thickness it is going into dermis also, that is its middle layers will be affected, and in the full thickness the deeply it will affect and we can able to see the bones. So that is the classification of burns. So now we are moving to clinical manifestations of burns. So what are the main clinical manifestations? Let's discuss. It is hypovolemia due to the heat production. So water will be lost from the body. So hypovolemia, decreased cardiac output, edema, decreased circulating blood volume, hyponatremia, hypothermia, hyperkalemia, increased potassium level, and hypothermia, decreased body temperature, hyponatremia, decreased sodium level. So these are the main clinical manifestation in the case of burns. Now we will see complications. So what is the complication of burns? What are the main complications here? Dehydration due to loss of blood and body fluids. So there will be dehydration, scarring of the tissue, hypothermia, psychological distress, breathing difficulties, and infection. So these are the main complications of burns. So now we are moving to fluid calculation in burns. So it's very important, fluid calculation in the case of burns. Let's see. First one is Consen's formula. What is Consen's formula? Lactate Ringer solution means RL. So lactate Ringer solution 2 to 3 ml into kg body weight into percentage of body surface area burn. So how it is calculating? So 2 to 3 ml. 2 to 3 ml into kg body weight. Example, that person's weight is 55 kg body weight, 55 into, example, the percentage of body surface area burned is 40%. So 40%. So the answer will be the ml. How that answer we need to take, and that ml we need to give as a fluid for the replacement for patient. So this is the formula of fluid calculation. First one is Consen's formula. Second one is Evans formula. What is Evans formula? How we will give the colloids according to Evans formula in the case of burns? It includes 1 ml into kg body weight into percentage of body surface area burn, electrolytes like saline 1 ml into body weight into percentage of body surface area burn, and glucose 2000 ml of insensible loss. This is the Evans formula. Next, coming to Brooke-Army formula, colloids 0.5 ml into kg body weight into BSR burn, and electrolytes into 1.5 ml into kg body weight into percentage of body surface area burn, and glucose 2000 ml for insensible loss. Next, Parkland and Baxter formula. So lactate drinker solution 4 ml into kg body weight into percentage of body surface area burn. So this is the definition. These definitions may ask for a 1 mark or 2 mark questions. This is also very important, and while writing for a 10 marks you need to add the fluid calculation as well. Yes, coming back to rule of 9 for burn. So what is rule of 9? How we can calculate the percentage of body surface area burn? How we will calculate? So it is divided into rule of 9 based head is. If head is injured, it is 4.5%. If the anterior part is 18%, back is 18%, both hands is 4.5 and 4.5%, and the legs is 9.5% and the genital area is 1%. So this is the anterior and posterior measurement we are taking, percentages we are taking to identify the total body surface area burn. So this is rule of 9 used to assess the total percentage of body surface area burn in the case of burn patient. Now let's discuss about pulmonary complication of burns. So it's a 2 mark question. It is a repeated question. So don't forget, while studying you need to study this pulmonary complication of burns. So what are the pulmonary complications? Let's discuss. So tracheobronchitis, chemical pulmonary edema, adult respiratory distress syndrome, pneumonia, pulmonary congestion and atelectasis. So these are the main pulmonary complications of burns. So it's a 2 mark question. Now you got the 2 mark question right. You will definitely get the 2 marks while you will write this exam. So now we are moving to what is the nursing care of patients who have burns. So it's also very important, nursing management. So promoting gas exchange and airway clearance. So we need to maintain fairly ABC. So what is ABC stands for? A for airway, breathing and C for circulation. So maintain ABC properly, airway, breathing and circulation. Next, restoring fluid and electrolyte balance. So giving by the fluid calculation, give the fluids to restore the fluid balance, and maintaining normal body temperature, minimizing pain and anxiety. So that person will have pain and anxiety, minimize the pain and anxiety, monitoring and managing potential complication. So these are the main nursing care in the patients with burns. So now we are moving to another important question from neurological system, that is cerebrovascular accident or CVA. It is nothing but stroke. So the question will be, you know what is stroke, but the question will come as cerebrovascular accident. Define and write about cerebrovascular accident. What do you mean by cerebrovascular accident? Let's see. It's a definition of cerebrovascular accident, or it's also known as stroke. So what it is also known as stroke by WHO in 1971 is the focal neurological deficit due to a local disturbance in the blood supply to brain. So it is the stroke occurring due to disruption of blood supply to the brain. Due to any causes, blood supply to the brain is disrupted, then the person will get stroke. That is defined as cerebrovascular accident. So now we are going to discuss about the types. So what are the main types of stroke or cerebrovascular accident? It is mainly classified into ischemic stroke, hemorrhagic stroke and transient ischemic attack or TIA. What it is? Let's see. So what is ischemic stroke? A stroke caused by a blockage in the brain artery. So if any blockage in the brain's artery that supplying blood to the brain, that is termed as ischemic stroke. Hemorrhagic stroke, a stroke caused by brain blood vessels bursting and bleeding. So any blood vessels that is present in the brain, that is any damage happened to there and the brain, it starts to bleeding, then that condition is hemorrhagic stroke. Transient ischemic attack, a temporary brief blockage in the brain's blood flow. So any blockage in the blood flow to the brain, that condition is transient ischemic attack. These are the main types of cerebrovascular accident: ischemic stroke, hemorrhagic stroke as well as transient ischemic attack. Let's see now nursing management. What are the nursing management? Assessment. Regularly check for neurological status, monitor functions, speech and swallowing and respiratory status. So we need to regularly assess the neurological functions of that person. Next, immediate care. Providing oxygen if needed and elevate the head, monitor vital signs and blood glucose level. So that's the immediate care. Next, medication. Administer appropriate medications like antiplatelet, anticoagulant or thrombolytic medicines. So medicines. What are the medicines? It's preferred for stroke or CVA as anticoagulants, antiplatelets as well as thrombolytic medicines. So these are the main medications or treatment used. Next, prevent complications, rehabilitation of the client and education discharge planning. So these are the main role of nurse in the case of treating a patient with cerebrovascular accident. So now we are moving to another important question, anemia. So what is anemia? Let's see. Anemia is a condition in which body lacks enough healthy red blood cells to carry adequate oxygen to the body tissue. So there is a lack of red blood cells to carry oxygen. So there will be oxygen deficiency in the body. It can lead to fatigue, weakness and other symptoms depending on the severity. So this is the condition called anemia. So what are the types of anemia? Anemia has so many classifications. What are the main types? It includes iron deficiency anemia, vitamin B12, folate deficiency, and aplastic anemia, hemolytic anemia, sickle cell and chronic disease anemia. So these are the main types of anemia. What are the types? Iron deficiency, vitamin B12 deficiency anemia, folate deficiency, aplastic, hemolytic, sickle cell anemia and chronic disease anemia. Now let's see what is the treatment for anemia. Iron supplements or iron-rich foods for iron deficiency anemia. If it is a case of iron deficiency anemia, iron-rich foods and iron supplements. Vitamin B12 or folate supplements, blood transfusion, medications to stimulate the red blood cell production and bone marrow or stem cell transplantation. So these are the main treatment for in the case of anemia. Now we will discuss about nursing care, monitor vital signs, especially heart rate and blood pressure. So we need to monitor heart rate and blood pressure of the client, educate patients about dietary changes or supplements. So educate the importance of having a dietary changes, help manage fatigue and promote rest, administer prescribed medications such as iron supplements or folate supplements. So these are the main nursing management in the case of anemia. So now we are continuing with next question, chronic obstructive pulmonary disease or COPD. So what is COPD? It's a very important respiratory condition. So how it is we can define. Its COPD is a progressive lung disease that makes it difficult to breathe. It is primarily caused by long-term exposure to irritant gases or particulate matter, most commonly from smoking. So it's mainly caused from smoking. COPD includes conditions like chronic bronchitis and emphysema. So it's a group of disorders. The conditions include chronic bronchitis and emphysema. So now let's see about stages of COPD. What are the main stages? Mild, moderate, severe and very severe. So 4 category: mild, moderate, severe and very severe. Mild means okay, shortness of breath and cough and sputum production. Occasionally or rarely the person will get the symptoms. In moderate, worsening shortness of breath, more frequent cough and reduced exercise tolerance will be there in the moderate. Now coming to severe, what will be there? Significant difficulty of breathing, frequent flare-ups and it is reduced quality of life. So that is the severe condition. Now coming to very severe. So what is the category? Fourth one, very severe. What it is? So extreme difficulty breathing even at rest, requiring supplemental oxygen and frequent hospitalization. So this is the main classification or stages of COPD. So stages is very important. 4 stages. This also will come for 2 marks, stages of COPD. So what are the main stages? Mild, moderate, severe and very severe. Now we are going to discuss about nursing management. What are the main nursing management? Let's discuss. So airway management. So ABC. So airway, breathing and circulation need to be managed. Airway breathing, airway management and monitor respiratory status. So track oxygen. So using pulse oximetry, track the oxygen percentage as well as do the ABG test, arterial blood gas analysis, and promote smoking cessation. So importance of smoking cessation, you need to educate to the client. As well, encourage vaccinations. To get the vaccinations against flu and pneumonia is important. Next, patient education and nutritional support. So these are the main role of nurse in the case of a COPD management. So this role of nurse you can apply to another disease conditions that affecting the respiratory system. So this is applicable for every disease conditions that coming from the respiratory system. Yes. Now we are moving to another important exam oriented question, leukemia. What is leukemia? Blood cancer. So leukemia is nothing but blood cancer. So it's a important question. Leukemia is a type of cancer that affect the blood and bone marrow. So it's a cancer that affecting mainly blood and the bone marrow. That is leukemia, and leading to an abnormal increase in the number of white blood cells. So there will be abnormal growth of white blood cells inside the blood. So that condition is called leukemia. What are the types of leukemia? So acute leukemia, acute lymphoblastic leukemia, acute myeloid leukemia, chronic lymphocytic leukemia, chronic myeloid leukemia, and chronic myeloid leukemia. So these are the main classifications or types: acute leukemia, acute lymphocytic leukemia, acute myeloid leukemia, chronic lymphocytic leukemia, and chronic myeloid leukemia. Yes, now we are moving to nursing management of clients with leukemia. So what are the nursing management? Monitor vital signs, especially we need to sign for infection. So monitor vital signs, we need to take infection prevention, pain management. So relieve the pain of the patient, they have pain, relieve the pain, blood transfusions, psychosocial support, providing counseling, education, and nutrition support. So these are the main role of nurse in the case of management of leukemia. Next, another important question that we are going to discuss is meningitis. So what is meningitis? Let's see. So it's nothing but inflammation of meninges, the protective covering that protect the brain. So it's nothing but the brain covering meninges is inflamed. That condition is called meningitis. Inflammation of meninges, the protective membrane surrounding the brain and spinal cord. So this is the definition of meningitis. What are the types of meningitis? Bacterial, viral, fungal, parasitic, and non-infectious meningitis. It is mainly due to bacteria and viral infections. So what are the nursing management? Monitor neurological status of the patient. So meningitis is affecting the brain's coverings, that is meninges. So we need to assess the neurological status of the patient. That is important. Pain management and administer antibiotics and antiviral. So according to that, disease causes, it is made either it is bacterial or it is viral. So treat with the antibacterials or antiviral medications. Hydration and nutritional support. So the patient need hydration and nutritional support. Infection control. So these are the main nursing management of patients with meningitis. Meningitis is nothing but the disease condition that affecting the inflammation of brain coverings and spinal cord covering called meninges. So in this section, we had discussed very important questions from different chapters. I hope everyone understood. For more videos, follow EZI Nurse. We will come with another important exam questions with next segment. So till that, thank you.